Hair loss affects men and women at every age. But here's the important part. Not all hair loss is the same, and not all of it is permanent. Before we talk about treatments, procedures, or transplants, we need to understand why it's happening in the first place. You see, hair loss isn't just one condition. It's a symptom that can have dozens of different underlying causes, from genetic factors to hormonal shifts, immune responses, physical tension, and nutritional deficiencies. Because when you understand the cause at a biological level, the solution becomes much clearer and way more effective. In this video, I'm going to walk you through the main types of hair loss from both a scientific and a practical perspective. We'll explore which ones we can treat, which ones we need to stabilize first, and how we build the right personalized plan for you here at Royal Wolf Clinic. Let's start with the most common cause, and that is androgenetic alopecia, also known as androgenic alopecia, or AGA for short. Androgenetic alopecia, commonly called male pattern baldness, is by far the most common type of hair loss we see, affecting around 50% of men by age 50 and a significant proportion of women as well. It's genetic, meaning it runs in families, and is driven by a hormone called dihydrotestosterone, or DHT for short. DHT is a derivative, it's an after product of testosterone, and while it plays important roles in the body, it has a unique effect on genetically sensitive hair follicles. It binds to androgen receptors in the follicle and gradually causes them to shrink and eventually disappear over time. We call that process miniaturization. The follicles, they don't disappear immediately, they just get smaller and smaller with each hair cycle, producing thinner, shorter, lighter hairs until eventually they stop producing visible hair altogether. For men, this typically starts with a receding hairline or thinning at the crown, following what we call the Norwood scale. For women, it's more diffuse, thinning across the top of the scalp, and the parting in the middle looks progressively wider. This follows something called the Ludwig scale. To diagnose this properly, we look at your medical history, family history, the pattern you're showing, and we examine the scalp under magnification using a device called a trichoscope or a dermatoscope. We can check how many follicles are miniaturized, what the hair shaft diameter is, and what stage you're at on the progression scale. And when needed, we run blood tests to rule out other contributing factors like thyroid, iron deficiency, vitamin D deficiency, or hormonal imbalances. Now here's the good news. Pattern hair loss is very treatable, especially when we intervene early. The earlier we catch it, the more follicles we can save, and the better the results. At Royal Wolf Clinic, we use a combination of evidence-based options tailored to your stage and goals. We use medications like Finasteride or Dutasteride, which are 5-alpha reductase inhibitors, which means they block the enzyme that converts testosterone into DHT, reducing DHT levels in the scalp by up to 70%. We also use Minoxidil. It's a vasodilator medication that increases blood flow to the follicles. It prolongs the growth phase of the hair cycle and encourages dormant follicles to re-enter that growth cycle. Then we layer in regenerative treatments like platelet-rich plasma and Royal PRP, which use your own concentrated growth factors like PDGF, VEGF, and EGF to repair and strengthen weakened follicles at a cellular level. For more advanced cases, we can use exosomes, which are extracellular vesicles or little bags holding products that contain signaling molecules that can activate dormant follicles, reduce inflammation, and promote tissue regeneration. And if the follicles are too far miniaturized to revive, meaning they've been inactive for years and the stem cells are depleted, we use FUE, which is follicular unit extraction hair transplantation, to restore density with your own permanent DHT resistant hair from your donor area. Now, pattern hair loss can sound scary, but with the right plan built on solid science, we can slow it down, reverse it, and rebuild it. Next up is Telogen Effluvium, which is one of the most common reactive types of hair loss. This usually happens after a significant physiological stressor, things like illness, surgery, rapid weight loss, crash dieting, childbirth, high fever, or major emotional stress. Here's what happens biologically. Normally, about 85 to 90% of your hair is in the anagen phase, growth phase, at any given time. And only about 10% is in the telogen, which is the resting phase before the hair sheds. But when your body experiences significant stress, it can push a large percentage of those follicles, sometimes 30% or more, into the resting phase all at once. And then 2 to 3 months later, all of those hairs shed at the same time. This is the type of hair loss where you suddenly notice more hair in the shower or on the pillow or in your brush, and it feels like it's coming from everywhere, not just one area. The key thing to know is this: Telogen effluvium is temporary. Your follicles are not damaged or destroyed. They've just shifted into a resting phase and will cycle back to growth once the trigger is resolved. And this means we start by looking for the trigger. Recent stress, illness, surgery, new medications, nutrition changes, thyroid issues, hormonal shifts, all of these can disrupt the hair cycle. We examine the scalp under magnification to make sure the follicles are healthy and not miniaturized. And we can run blood tests to check serum ferritin, which is for your iron levels, vitamin D, thyroid function, and B12 levels. Once we identify and then address the triggers, the hair usually recovers naturally over time. To support and accelerate that recovery, we use treatments like microneedling with growth factors, PRP, royal PRP, or exosomes to stimulate the follicles back into the anagen phase and reduce any inflammation. Most people see noticeable improvement in 3 to 6 months and full recovery by a full 12 months. Now let's talk about traction alopecia, which is a form of mechanical hair loss. This is caused by repeated or prolonged tension on the hair shaft and follicle, usually from tight hairstyles like braids, ponytails, buns, weaves, or extensions. The constant pulling causes chronic inflammation around the follicle, and over time this can damage the follicle's structure and blood supply. If you catch it early, it's completely reversible. The follicles can recover once that tension is removed. But if you leave it for too long, the chronic inflammation can lead to fibrosis, which is scarring, and permanent follicle loss. The first step is always to remove the tension. No treatment will work if the mechanical stress continues. Once the scalp is resting, we use royal PRP, exosomes, and microneedling to reactivate those weakened follicles, reduce inflammation, and stimulate collagen remodeling in the scalp tissue. If an area has progressed to scarring and the follicles are permanently lost, then we can use a small, targeted FUE transplant to restore the area, but only after the scalp has fully healed and the tension has completely stopped for at least 6 to 12 months. Let's talk about postpartum and menopausal hair loss, because after pregnancy or during menopause, hormonal shifts can trigger sudden shedding or gradual thinning. This is incredibly common and completely understandable when you consider the massive hormonal changes your body goes through. Postpartum shedding, also called postpartum telogen effluvium, typically starts 2 to 4 months after birth. And during pregnancy, elevated estrogen levels keep more hairs in the growth phase, so your hair feels thicker and fuller while you're pregnant. But after delivery, estrogen levels drop sharply, and all of those hairs that were held in the growth phase now shift into the resting phase, and that means they shed all in one go. Your ponytail starts to feel thinner, your parting looks wider, and your hair just doesn't feel the same. During menopause, estrogen levels decline and androgens become relatively more dominant, which can trigger a pattern similar to androgenic alopecia, which is diffuse thinning across the top of the scalp. The good news is that both of these are very manageable with the right approach. We check first for iron deficiency, which is very common after a childbirth, vitamin D, thyroid dysfunction, which can also occur postpartum or during menopause, and any other underlying factors. Then we support recovery with royal PRP, microneedling, exosomes, nutritional supplementation, and when needed, low-dose minoxidil to prolong the growth phase and stimulate regrowth. Most women do see noticeable improvement within 3 to 6 months, with fuller recovery taking up to a year. Let's talk about alopecia areata, which is an autoimmune condition, meaning your own immune system mistakenly identifies the hair follicle as a foreign invader. T lymphocytes, which are a type of white blood cell, they attack the follicle during the anagen phase, causing it to stop producing hair and enter a dormant state. This usually results in smooth, round patches of hair loss, often appearing very suddenly. For most people, the hair grows back naturally as the immune attack subsides, but other people may need some treatment to help calm that immune response and stimulate regrowth. We diagnose it based on the characteristic pattern, the dermoscopy findings like exclamation mark hairs and yellow dots, and sometimes blood tests to check for associated autoimmune conditions like a thyroid problem. For treatment, we can use several different things, like an intralesional steroid injection to reduce local inflammation, topical immunotherapy in some cases, PRP and exosomes to help modulate the immune response and stimulate the follicles to re-enter the growth phase. For more extensive cases like alopecia totalis, which is total scalp hair loss, or alopecia universalis, which is total body hair loss, we can work closely with dermatologists and may consider systemic treatments. Importantly, we do not perform hair transplants while alopecia areata is still active, because that means the immune system could attack the transplanted follicles as well. Let's talk a little bit about scarring alopecia. Scarring alopecia, also called cicatricial alopecia, is when chronic inflammation destroys the hair follicle permanently and replaces it with a fibrous scar tissue underneath the skin. Once that happens, the follicle's stem cell niche is completely lost and it cannot regenerate or grow hair again. There are several types, including lichen planopilaris, frontal fibrosing alopecia, central centrifugal cicatricial alopecia. Each of these have slightly different causes and patterns. Our priority here is early diagnosis, because if we can identify and stop the inflammation early, we could preserve the follicles that are left. But treatment here, in this case, is medical first, not surgical. We work closely with dermatology to control the inflammation using medications like topical or oral corticosteroids, hydroxychloroquine, or other immunosuppressants. A hair transplant can only be considered if the condition has been completely inactive, confirmed by biopsy and clinical examination for at least 12 to 24 months. Even then, the risk of recurrence of the disease must be carefully discussed. So, which types of hair loss can we treat here at Royal Wolf Clinic? Most non-scarring types are highly treatable. Androgenic alopecia, telogen effluvium, traction alopecia if it's been caught early, postpartum thinning, menopausal thinning. Alopecia areata is case by case depending on severity and activity, and scarring alopecia is medical management first and only transplantation if the condition has been inactive for a long period. If it's treatable, we will build a personalized plan based on your specific cause, severity, age, medical history, and your goals. Our treatment options fall into three evidence-based categories. Number one, medical therapy. Medications like Finasteride and Dutasteride to reduce DHT at the follicle level. Minoxidil to stimulate blood flow and prolong the anagen phase. Biotin, iron, vitamin D, and other nutritional support where deficiencies are identified. Number two, regenerative therapy. Things like PRP and Royal PRP, which use your own concentrated growth factors, including platelet-derived growth factors known as PDGF, vascular endothelial growth factor known as VEGF, and epidermal growth factor known as EGF to stimulate follicle repair and regeneration. Exosomes, next generation extracellular vesicles that carry signaling molecules to modulate inflammation, promote angiogenesis, which is new blood vessel formation, and activate dormant follicles. Microneedling with growth serums to enhance absorption and stimulate collagen production in the scalp. And number three, surgical treatment. FUE, hair transplantation, when follicles are too miniaturized or dormant to revive, allowing us to restore density with your own permanent genetically resistant hair from your donor area. Everything we do is evidence-based, ethical, and personalized to your unique biology and goals. What makes us different is simple. Diagnosis first, treatment second. Every single patient starts with a comprehensive hair loss assessment. We take a detailed history, including family history, medical conditions, medications, lifestyle factors, and timeline of hair loss. We assess the pattern and the distribution of thinning. We examine your scalp under magnification with a trichoscope to evaluate the health of your follicle, hair shaft diameter, follicle density, and signs of miniaturization or inflammation. We run blood tests when needed, including a full blood count, ferritin, vitamin D, thyroid function, hormone panels, and other markers to identify any underlying medical or nutritional factors. And we perform digital density mapping to objectively measure the extent of thinning and track your progress over time. By the end of that assessment, you'll know exactly what type of hair loss you have, what's causing it at a biological level, whether or not it's treatable, and what the safest and most effective plan is for you. We never rush anyone into a transplant. We only recommend what's scientifically appropriate for your stage, your health, and your goals. We're GMC-led, CQC registered, and we perform thousands of successful procedures with natural, long-lasting results. We specialize in natural, age-appropriate hairlines, advanced FUE techniques, and regenerative medicine all under one roof. And more than anything, we care about honesty and education. If treatment is not right for you, or if we need to stabilize your condition first, we'll tell you and we'll guide you safely through every step. If you've noticed thinning or shedding, don't panic. Most types of hair loss are treatable once we identify the biological cause and build a plan around it. So book your hair loss assessment here at Royal Wolf Clinic. We're committed to ethical, evidence-based, and personalized care rooted in science and delivered with compassion. Your hair deserves a plan, not a guess.